Through our mobile health units, which we have 2 now here in Marion County, we seek to make the healthy choice the easy choice by making sure that we're taking the services we provide within the 4 walls of our health department out into the community. Whether you're a resident or you're a community organization, we probably have something that's of interest to you. We also focus on chronic disease prevention because we do have higher rates of diabetes and heart disease here within our community. And we offer free diabetes management classes actually as part of those chronic disease efforts. We love to work with all of our different partners in the community and find new ways that we can collaborate to make sure that we have healthier residents and healthier community.
It's marion.floridahealth.gov, and all these programs are listed on that, and how there's information on how to get registered for them.
Excellent.
We have a fantastic board of county commissioners here. They're all wonderful to work with. Their support of public health enables us to do what we need to do.
Healthcare in Florida's rural counties face mounting challenges. Geographic isolation, health worker shortages, provider burnout, accessible health information, the burden of care for chronic health conditions, substance abuse treatment, and mental health issues. All of these issues continue to impact all aspects of our communities. Welcome to Marion Voices, a production of the Marion Forum Group. I'm Bob Raymer, the host of today's episode. What are some of Marion County's challenges and solutions to these ongoing public health issues? Today's guests are the point people for our public health efforts in Marion County. Mark Lander is the administrator for the Florida Department of Health, and Christy Jergens is Marion County's community health director. Mark, Christy, thank you for joining us today for this podcast.
Thank you, Bob.
Thank you so much for having us.
What would you like to add to that in terms of the introduction?
Well, I just think, you hit on some very, very valid points when you start talking about, what are some of the challenges we face. And I know from our concern, and I'm sure Christy can add to this, is, I've been in public health. This is my 35th year. And I've worked in small counties. I've worked in large counties. And it's not the fact that the resources are there, it's just how to access them. We tend to find that whether it's working in silos or just, some of the difficulties in accessing a resource. And we overcome that by information sharing. And the best, you're giving us an opportunity here today to talk a little bit about some of the ways we've worked on overcoming these initiatives and challenges.
That's great to hear. And Christy, your sense of purpose in this endeavor here for public health in Marion County?
Sure. So I've worked in public health for about 9 years, but I've lived in Marion County for longer. I used to work in county government. I have seen how the needs can differ depending on where you live in our community, and also the challenges that some of our different residents face on accessing services depending on where they live in the community. So as community health director, I look to see how can we serve the needs of all of our residents in the communities where they are, and just try to provide them the best service we can.
Before we begin discussing some of these programs and initiatives of the county health systems that impact our communities, would you share a brief summary, each of you, on what your roles are specifically on behalf of the city of Ocala and throughout Marion County, and in fact, on behalf of other counties in Florida?
Absolutely. Bob, I really have 2 roles within the state right now. I serve as what's called the Deputy Secretary for County Health Systems. So I oversee some of the actions in all 67 counties, but I also focus primarily here in Marion as the administrator, where my role is to work with not only internal partners, which is my staff, but external partners to addressing the community needs, whether it's starting new initiatives, beefing up an existing initiative, really looking at data all the time, looking at data. Where are we at? Where are we lacking? Where could we improve on some of our numbers? And then finding our partners. It's all about collaboration. We are truly a village, and you have to bring in all your partners to collaborate to meet that common goal. So that's really my role as the administrator of the health department.
Yeah, and it's a dynamic situation, not only in Marion County, which, Christy, I'll have you speak to that a little bit more, but in relation to other counties and in the state. Your particular interest in Marion County, your responsibilities, I should say, would be what?
So as community health director, I work with several different programs and oversee them. So I work with the mobile health unit. I work with the school health program. I work with health education, Healthy Start, and the overdose data action program. So a lot of the different programs that involve educating the community, interacting, and making sure that they understand some of these different priority health topics and how they can access those resources so that they can live their healthiest lives.
Yeah, that's a full spectrum of options you exercise.
Right, and I think you both have made the comment that's clear that it's a situation where what may be happening in Escambia and in Miami-Dade isn't necessarily effective of what's going on in Marion. So we focus on those community efforts and community efforts and needs, particularly for our region and our area. And see, you have to also look at what's going around, like you said, with your neighboring counties. What's happening in a shift in a Volusia or a Lake or a Sumter may eventually bleed into Marion County. So we have to always be I'd say alert, working with our neighboring partners as well to address community needs.
Fair enough.
I was going to say that's a really good point because I know with overdose data action, for example, challenges with substance use, they certainly cross county borders. And so we're always in constant communication with all of our different neighbors to see how we can best partner together just to better ensure that we're addressing what's going on in our communities.
Yeah. And you obviously, the Marion County has a foundation based on your work and your operations that you rely on to coordinate with other counties as well as within Marion County. So what we would like to do is discuss some of the efforts related to these initiatives. And I know both of you have topics that you want to expound upon. So let's jump into that.
Yeah, if you don't mind, I think we're going to kind of ping pong back and forth
Absolutely.
on a couple of topics. Well, one of the issues you talk about challenges in rural communities and even in Marion County, as large as we are, dental care. I think that's huge. One of the advantages we have here in Marion County is we actually have a site-built clinic at not at the health department, but the health department manages with the College of Central Florida over at the Hampton Center on State Road 40. We have our team providing both children and adult dental, working with that collaboration. We come in, a lot of our stuff is done through our Medicaid with our children, but we even have a sliding fee schedule, which can slide all the way down to zero depending upon income eligibility for adults. To have that dental, and that's important because not everyone understands that process is operating. We have a small program in the schools, our dental sealant program, where we partner with Marion County public schools. We go in and we do sealants in specific age groups. But one of the other highlights I think that we'd like to point out is we've just recently started. We work on special needs, our special needs clients for individuals with intellectual and developmental disabilities. It is a very, very it's a very sensitive subject to work on, and very vital that we have in our community because it is a lacking resource. We have a brand new dentist at the health department. She's made it her passion, as well as our partnership with the University of Florida dentistry, to try to help serve these clients, which is so vital in Marion County. So, the dental program addresses that community need, but it's just such a vital resource for our residents in Marion County to have. Another topic is environmental public health. It's called environmental health. Just recently changed the name to environmental public health. We get out and we do. It's really all 67 counties in the state of Florida have this program, have an environmental health program. The primary focus is to prevent disease, the spread of diseases through, I say, regulation and education. There's like tanning booths, mobile home parks, where there's some sort of regulatory component to those, drinking water systems, public drinking water systems, private drinking water systems. And we tend to protect health and promote health through regulation and education of the individuals, these owner-operators, the individuals using these particular facilities. We also provide the education on safe ways to use a facility. And that includes food safety. The food safety in Florida, I'd say it's interesting because there's several agencies that regulate food. Everyone thinks, it's a health department must regulate a restaurant. No, that's either by Department of Business and Professional Regulation, DBPR, or Department of Ag. But the health departments, we focus on institutional food, schools.
So it's not the food inspections for restaurants as a larger facility.
Right. We do like it could be hospitals, the hospital food. We do the residential facility food when it comes to like schools.
Would it be senior facilities, anything like that?
If it's
large enough.
If it's large, we would do that facility, but we typically do not do the restaurant component side, which is handled by others. It is, and not a lot of people. We get calls and complaints weekly, and what we do is when we take those calls, we refer them over to
Sure.
the appropriate. We look and see where the restaurant was and find the appropriate regulatory agency and refer those individuals to that agency. So their call can be handled quickly. We want to ensure that their concerns are addressed quickly. But we also, we look at the permitting programs. I think we looked at some numbers for last year, and we regulate and educate over 2,300 facilities in Marion County every year.
Wow.
And I did briefly just say, water well protection. We do we do a program for the water management district. We do the well permitting program when it comes to the drilling of new wells in Marion County. And last year's numbers, I think we permitted over 3,000 wells in Marion County. So that group stays really, really big. Really busy, I should say.
And just to clarify, too, when it's not only the drilling permits, but is the water testing involved with the Department of Health?
The water testing is something separate.
Gotcha.
I am excited to say that we are in the process right now of revamping our environmental health section, and we're getting ready to open up a water testing lab for bacteriological. It's a community resource. In the counties I've worked in before, we've always had that lab, and not very many counties in the state have that anymore, but it'll be a resource we hope to have opened up by the end of the year, where if an individual wants a bacteriological analysis of their water at their well for a small fee, they can come in and we'll be able to run that for them locally instead of sending them out to private labs or outside the county. So
that's a great added advantage.
It's going to be huge when we can get that up.
Yeah.
So I'm going to ping pong it over to you because I'm doing all the talking, so it's your turn.
What?
You have your pick of topics.
Yeah.
Yes. So I want to talk about our health education program briefly.
Please.
So our health ed program focuses on educating people about different health topics that can have long-lasting impacts. So we have several main programs that are kind of part of that health ed program. So our Safe Kids program focuses on injury prevention in ages 0 to 18. So that's going to talk about stuff like pedestrian safety, swim safety, car seat safety, and home safety. So think about even like batteries or fire alarms or swim lessons for the swim safety. We have our healthy aging program, which focuses on dementia and fall prevention, and that's highly relevant here within Marion County. We've unfortunately been 1 or 2 in fall-related deaths here compared to the state of Florida. And of course, 38% of Marion's population is 60 plus years old.
That's the key, isn't it?
Yeah. So it's a topic that's very relevant to our residents here.
Sure.
We also focus on chronic disease prevention because we do have higher rates of diabetes and heart disease here within our community. And we offer free diabetes management classes actually as part of those chronic disease efforts. We also have the Brazen program, which focuses on positive youth development and positive decision making. So that's going to cover things like bullying prevention, social media, internet safety, suicide awareness, respectful relationships. And this is important because teens are typically talking to other teens and they may or may not be getting the best information and advice. And so you may have seen some of our different health ed programs at work in the community through bike rodeos or the swim lessons that I mentioned, car seat checks. And let me just do a quick plug for car seats. We are one of the only agencies here within Marion that can provide a free car seat, assuming that you qualify by income. And we do frequent car seat checks in the community to make sure that your car seat is properly installed so that if you were to get into a crash, that your child's going to be safe.
I'll just interrupt to say that there's an awful lot of information coming across from both of you.
Yeah.
And I want to assure our listeners that we are going to make the opportunity to either access the websites or the scheduling so that they can learn more about this. Now, I'd like to just pause on Brazen a little bit, too.
Yeah.
This particular program, if you could give us some more details of where it takes place and how it's organized. Is that in cooperation with the schools, or is this something that's an extracurricular issue that you bring in various community members to do that?
So it's both. We go into the schools and provide services in there, teaching the students while they're in school. And then we're also doing events. So we focus on both the youth and the parents as well. For example, we just recently did a presentation to all of our different bus drivers here within Marion County Public Schools before they started to let them know about things like child abuse and, neglect and what those situations may look like so that they can better interact with these youth when they're getting on and off the buses every day.
That's a great idea.
Yeah, so it's both the adult component and the youth component that goes into it.
And I think it's a big part of what you're saying. A lot of our job is education. It's providing that education, helping our residents out by giving them the tools to make the choices.
Yeah. Well, attention is prevention, and I can see where that's key. Again, with some of these other education programs, some of them are obviously on site. A lot of it could be online to communicate that to people that may not be able to show up.
We have some different resources on our website to try to make sure that we're getting that health information to the right people.
And if they'd like, I mean, the website information, I'm sure we can post it later, but
absolutely.
It's marion.floridahealth.gov, and all these programs are listed on that, and how there's information on how to get registered for them.
Excellent.
And and I know Christy just mentioned the swim vouchers, and we have Florida. Last year, Governor DeSantis worked with the Florida legislators, and they were able to initialize a swim voucher program for children 0 to 4 years of age, meeting certain requirements. Through his work this year, they've doubled the funding for that program, and we get quite a bit of funding that we're able to provide these vouchers, and individuals can work with our partners. I believe we have the City of Ocala and Aquatic, the FAST program out in West Ocala that accept these vouchers, and it's been a very successful program.
It's a fantastic program. Where would you like to go beyond that too? I know that we've talked about some of the solutions they have already, but some of the challenges that Marion County uniquely faces in terms of being a rural county, and by that I mean substance abuse education, mental health services, and chronic health conditions. Any of those topics that you would like to address?
You want to talk a little bit about OD2A?
Sure. So our Overdose Data Action Program looks to educate people about different drugs that are involved with overdoses, educate people on how to respond to an overdose, advise them as well where they can obtain free Narcan, letting them know what signs of an overdose look like. When we originally started the Overdose Data Action Program several years ago, we partnered with Ocala Fire Rescue and the Marion County Insurance Alliance. We were building it's called a bridge program, to where a paramedic would respond at the time of an overdose or to the hospital, and they would immediately connect that individual to substance abuse treatment if they were willing. I'm really happy to say that was really the foundation for our local launch of the Coordinated Opioid Recovery Network, which works in coordination with Fire Rescue locally, SMA, Beacon Point, to get those individuals connected to that long-term care, because it's not. There's both a medication aspect of it, medication-assisted treatment, which has shown to be more effective than just going, cold turkey.
Sure.
For someone who's facing substance use concerns. There's also the mental health aspect. So you can ensure that the person is going through the system is getting the coordinated care that they need to address all aspects that may be contributing to their substance use disorder. We've been so happy, and Marion's really been a model as far as how it's responded in the community to overdoses.
And I think you bring up great points especially with Beacon Point and their efforts that they've worked in this. It's that with that campus, it's individuals seeking treatment are able to get so many services provided on site. So it's not, we know transportation is an issue. We've talked about how that can, especially in rural counties. So an individual who is in there for specific substance abuse treatment, there's dental services that can be provided. We're currently working with Beacon Point to provide some of those services with them at our Hampton Center, which is right down the road. But then there's also primary care component and other social services, and all that what Beacon Point has done is really amazing, being able to bring it all to one location for our residents. So I think that's huge, and it is a way to address a large need in this community.
Because when clients are in crisis, they're not necessarily able to as easily access that as someone who is not in crisis.
Yeah. Well, the point you're making is this is a very comprehensive program, and I don't think a lot of people will realize it till they've heard you explain the pyramid of care that's taking place here, from the introduction, either in crisis or for overdose, and then through potential treatment and rehab.
And if I may plug in quickly, because we were talking about overdoses, anyone can access free Narcan at any of our Department of Health and Marion County facilities or on our mobile health unit. Having Narcan, even if you don't expect to encounter an overdose, there's always the possibility that you may. And so you'll have it, you'll be able to save a life. So please get free Narcan from us if you have the opportunity.
What a great offer. I also, you just touched upon the mobile health unit, and I think I'd like to have you expand on the offerings of that, because that's another tip of the iceberg, if you wouldn't mind. That's
a program that, like I said, that's close to the heart. I love, Christy's been managing that program for several years, and I think, as we said, it's what the health department's not just within four walls. It's taking services out in the community. So I'll let you. That's your baby right there.
So through our mobile health units, which we have 2 now here in Marion County, we seek to make the healthy choice the easy choice by making sure that we're taking the services we provide within the 4 walls of our health department out into the community. Marion County is extremely large land-wise, and it can be frankly difficult for people to, drive in or just get access to some of the services if they live quite a bit of distance away. So the mobile health unit takes a lot of the different services we provide at the health department and goes out to sites in Denellen, Fort McCoy, the Forest, Marion Oaks, and provides those services. So that's include testing, health screenings, WIC services. That's been a really successful partnership.
WIC has been huge, being able to, especially when you start getting out there, Denellen, and someone having to drive, 25, 30 miles in for a service.
Right.
Now they can get it right out in their hometown.
Right. Health education. And then we also really recently started providing health screens there within the past year. That's something that we were really excited about because we know that there are those rates of chronic disease that may be undiagnosed. We had done over 360 health screenings here just within the past fiscal year. And we had, I think it's just over 70 people find out that they had prediabetes or diabetes.
Sure.
So they weren't aware of that. So now they're aware. Now they can get connected to care. And now they can get into treatment so that they can prevent the progression of that.
Yeah. You mentioned testing as well as screening. Now, what would be the scope of testing for the mobile health unit?
You can do STD screening, anything, because we always curious to make sure we don't have outbreaks. So we can do STD screening, HIV screening.
Yep.
It's really, like I said, from the other components, like you talked, the diabetes component, blood pressure, just really to trying to prevent a disease from worsening is what we're looking at.
Yeah.
A1C, LDL, HDL.
Yep.
So,
that's pretty comprehensive.
Yeah.
And for an individual who has not had the chance or has not over a period of time made an appointment to do that or has a regular health provider, that's outstanding.
And I'll just say it's so important because when people are farther from the care provider, right, they might delay seeking care, and that allows the opportunity for any type of condition to worsen and to progress. And so when you can identify these things at that earlier stage, it only improves the outcomes for the resident.
Did we talk about Healthy Start and WIC more specifically?
Those are 2 great programs. Very proud of them. So
I don't want to miss anything.
I'll let her cover those, and I'll cover one. I'll cover emergency preparedness.
I think I have something for you later.
Oh boy!
For the time being.
Yeah.
So Healthy Start's mission is to reduce the prevalence of low birth weight babies and cases of infant mortality. So very important, while also improving maternal and child health outcomes. So they achieve this through a free and voluntary home visiting program for pregnant women, mothers, and infants up to that age 3. All pregnant women are offered a Healthy Start screening either at their first prenatal appointment or upon exit of the delivery facility. Once enrolled, each participant receives a monthly home visit from a care coordinator. They have an individualized care plan based on what their needs are. So they're going to be receiving education on topics such as, how to prepare for a baby. What if you're a young teen mom? Maybe you don't know how to care for a baby.
Exactly.
Even as an adult, you hardly know how to care for a baby at times.
Well, they don't come with manuals.
Right,
so
they don't at all.
It's the same for everyone.
But they're teaching how to prepare for the baby, what different support resources there may be available, also providing things like diapers and wipes. And it just helps ensure that that optimal outcome, that better outcome.
Yeah.
We had a really great story recently where one of our care coordinators was educating a client about signs of preterm labor. And then the client did actually end up going into preterm labor, and she really credited her care coordinator with educating her on that because she thought that the outcome would have been much worse if she hadn't had that education through the Healthy Start program. So it's has substantial impact.
For sure.
Yeah, for many families.
And that goes in hand with WIC, I presume.
Right. So our our Women, Infants, and Children program focuses on mothers, infants, and children up to age 5. Program eligibility is set by income and your household size. If you are the pregnant mother, that includes the baby inside you, so that'd be automatically a household size of 2. So at no cost to the client, WIC provides healthy foods, nutrition, education, and counseling, breastfeeding support, and referrals, of course, to support and community resources. Overall, their focus is on maternal, birth, and child outcomes. And I will tell you that the WIC program has great statistics as far as the impact that it has on reducing infant mortality, improving growth in nutritionally at-risk children, and improving the duration of pregnancy and birth weight, which are all linked to better health outcomes.
Right.
Our WIC program serves clients in our Ocala office, Reddick office, Bellevue office, and then at our mobile health unit locations across the county. They also provide services in Sumter County and Bushnell.
Yeah, we provide the WIC program services for Sumter County.
Yeah.
So.
And we had I'll just give you a little blurb on a recent client served. So as part of the regular services, we're doing labs on children to make sure that they're progressing.
Sure.
And one of the lab results was really low for a child, and they immediately referred the child to the ER and found out the child had leukemia. So they were able to go ahead and start that child into care, and otherwise that may have not been seen.
Yeah.
And I think it's one of the, just recently also, the program they got a breastfeeding awareness or award for that, for our work in our breastfeeding with the clients. And I think they're going to be receiving that excellence award later this month.
Yes.
So they're fantastic. That's a great group of individuals that work in that program.
Yeah, that's great to know. And again, share that with our listeners. I don't know whether you're going to take this one, Mark, or not, but one of the items on your list was the staff special needs shelters.
Oh, absolutely.
And that's given that we're in hurricane season, given that we have emergency alerts for heat at this point and possible flooding at some point. Yeah. Talk a little bit about what your role is in that.
I was going to say, well, your timing is impeccable.
Thank you.
No, absolutely. We work closely with emergency management out of the health department. We have a preparedness planner. A gentleman works year round with our staff. Number one, training our staff, because one of the roles of the health department is to manage a special needs shelter for our clients, medically fragile clients. Some of them oxygen dependent, others electrical dependent.
Sure.
So in the event that they were to lose power to their homes, their care could be compromised. So we work closely with emergency management. We identify, I think we have over 600 clients right now that we've identified in Marion County that in an instance of like if a storm were to heading our way, we typically call all the clients on the registry every time, and
that's all 600 basically.
Yeah, are you going to be needing services? Because if they are, we need to verify. Okay, we have one shelter open. If the numbers get too high, we have a second special needs shelter. Our main shelter is Westport High School, but if we have to open a second shelter, we go to Liberty. But number one, our staff are currently trained year round on their roles. Everyone we've divided into. We have 5 or 6 teams within the health department, staff or shelter management teams. To avoid that burnout. So individuals are maybe in there for a day or two, and then we rotate in and out of timing. But it's really our role is to care for those clients, to make sure that they've got their oxygen, to make sure that that any needs that they have are met. And we also work closely with the community because there are individuals that may come in beyond our point of care. Like I said, the saying for the special needs shelters, they're a lifeboat, not the love boat. So it's, there are individuals that maybe go beyond our scope of care. So we work with nursing homes and with our hospital systems to try to get those individuals housed in those facilities in the event that they were going to need to move for a special needs shelter into a special needs shelter. But we work closely, like I said, with EM. Preston Bolin does a great job over with emergency management. And we're, identifying not only are you going to be at the shelter, do you need transportation? Because then if they need transportation, we work closely with the Marion County School Board and Marion Senior Services, and we get those individuals transport pickups, get them to the shelters on time, get everybody there, hunker down for the storm, and then try to get them back into their environment as quick as possible. But the preparedness section, Randy Ming is our preparedness planner. Like I said, he works internally and externally with partners. As a matter of fact, Marion County under Randy's guidance just got they're accepted for what's called Project Public Health Ready, and that's a federal recognition as far as that's done by county that you have worked with your partners, you've shown your capabilities, and your capabilities are set to respond to both man-made and natural disasters. So that was a huge accomplishment. It was we've been, I think this was the time we were doing a recertification. We've been certified for several years, but we just recently got our recertification back on that. So it's a constant process, but it's working great. We work, like I said, with Preston and the EM, and we have a fantastic board of county commissioners here. They're all wonderful to work with. Their support of public health enables us to do what we need to do.
Yeah, what I'm hearing from you is that public health in Marion County is some of your partnerships, and that's and of course, I think that's your mantra in a way. Yeah. I know you are out there in the community, you're working with people in the community, partnerships in the community, and educating the community. Right. There's a few other things I'd like to cover,
Okay,
but
absolutely.
is there anything else that from your listing that
I think we're good.
Yeah.
you really covered a lot of ground?
Pretty thorough.
And again, I'd like to reiterate for our listeners that we will have points of contact for this. In many cases, it's, as you said, the website you gave us, which will be listed here. And if they want to research some of the partnerships that you've talked about or follow up on that, they can drill down through the website. And just as a thought experiment, if you will, let's say we have an outbreak of an infectious disease. It could be measles, it could be whooping cough, potentially it could be both these days, Lyme disease. Anything, even wildfire air quality might be an issue that comes up. And what I'm asking you, not necessarily is that your obligation, does it fall under your purview, but what would Marion County residents, where would they find that information, or what could they do to learn more about outbreaks like that?
We work closely with the partners, and specifically, you talk if it's wildfires or something, or flooding or anything to that component. We post that with emergency management's website. They provide a lot of documentation on after the storms. What to do for cleanup and safety information. We also post information with the Board of County Commission. We use their website as well. Our website, on the top of our website, there's an alert section. Usually, if there's something that's going on that is of major concern, you can click on the website, that marion.floridahealth.gov, and go to the alert section, and that provides information as well.
I just want to give you the chance to include anything else at this point that you might wish to summarize. And all I can tell you is that how comprehensive the efforts you're here. It's very encouraging, because while most people may not act on it,
right,
they have access to it. And if they look around and if they follow up on some of the issues that you've talked about, they can get answers. And that's really important for a county as large as this, a rural county, again. So I'll leave it open to you for a summary, if you will.
Go ahead. Go first.
I would just say, whether you're a resident or you're a community organization, we probably have something that's of interest to you. So please visit our website. Come check us out if we're out in the community at a table or, a community event, and find out a little more about us. We love to work with all of our different partners in the community and find new ways that we can collaborate to make sure that we have healthier residents and healthier community.
And I think that's fantastic. What you just stole what I was going to say.
I'm sorry.
No, I'm just kidding. And the reality, it goes back to, and if you look at the website and you don't feel like your question's been answered, there's numbers on the website. Please make that phone call, because if it's something we may not do, we probably know who does it.
Exactly.
And again, when we talked earlier, it's a difficult system to navigate from when it comes to healthcare and then resources, but we usually, by talking and working with community partners, we solve these problems together. So it's, I don't want, just because it's not listed on our website doesn't mean we don't know how to get you to that right resource.
So I'll reach out and call, and you'll direct them to whatever they might want to follow up on.
And Bob, what we're doing here today, I can't thank you enough, because it gives that opportunity for us to provide this information out for our residents.
Yeah, we're grateful to have you to detail it, because as so much of this is out there without everyone necessarily knowing how to access it and how to follow up on it. I've been talking with Mark Lander and Christy Jergens, the Marion County Health Officer and Community Health Director, Administrator for the Florida Department of Health.
Either one works.
And an advocates for improving the health of all citizens across the state of Florida, particularly in Marion County. Mark and Christy, thank you so much for taking the time to inform us on all these issues today.
Thank you, Bob.
Thank you so much for having us.
It's been a pleasure. Thank you.
Absolutely.